June.
Fabulous. Okay, would you like for me to get started?
Yeah, it looks like we've got about 25 people, so I think that's a good crowd to start with.
Fabulous. Okay. Well, I want to thank you, everybody, for taking the time to be with us this afternoon. We've got a really neat discussion that's going to happen today, and I'm just super excited and also extremely grateful. This is being brought to you by our friends at NAMI Greater Houston. Everybody, yay, NAMI! They're putting together a panel or a series of panels all looking at a variety of different issues that are affecting mental health and well-being here in the greater Houston area. And so I was asked to put together this panel, and so let's just go ahead and jump into it. I'm going to share my screen with you and take you through just a short presentation just about a research project I did and what I've learned about the power of single stories, and then we'll go to our panelists. So the name of this panel is The Diagnosis Culture, Stories as Poison and Cure in Maternal Health. And we have some great panelists here. Let me set up real quick. Okay, fabulous. So this is being moderated by me. I'm Cecilia Oller. I'm a recent graduate in cultural sustainability from Goucher College in Maryland, limited residency program that's based in Towson, Maryland. And I did it all here in the confines of my home in Houston, or most of it. And this project was actually my master's degree. It was my thesis. We're going to be joined today by panelists Amelia Averett, Al Chanel, and Uchenna Jones-Conley. And once again, this is put on by NAMI Greater Houston. So before we get started, I want to ask you a few questions. Besides COVID-19, okay, what illness, let's see here. Here we go. Besides COVID-19, what diseases are you the most afraid of getting? Don't tell me. You have to chime in and let me know what the words are. But I just want you to get that thought in your head. So besides COVID-19, what diseases are you kind of primarily afraid of? Okay, so very quickly, who gets this disease? Who's the picture that comes up in your head when you think of this disease? Who's the person? Okay, once again, keep that to yourself. Then why do they get this disease? What are the reasons as to why they get this disease? Okay. How is it that you are not getting this disease? What are all the different things that you're doing that makes you different from them? Okay. Now, what you just did in the space of about 30 seconds is you told yourself a story. And that story was waiting for you. You tapped into a storyline that communicates you by your membership within community. There's a biological model for this. It's called the mycorrhizae layer, okay? Under every forest is something called the mycorrhizae layer. Now when you're walking the forest, you see the individual trees, but those trees are actually connected underground by a fungal layer. And that fungal layer is a lot like kind of a superhighway that connects all of the trees, all the flora within that forest to each other. It's a fungal layer that is a conduit between the individuals within the forest where they can share resources. They share oxygen, sugar, nitrogen. They also send chemical signals to each other, okay? And through those chemical signals, they can actually communicate across the forest. So not only are they sharing resources, but they're sharing information. So if there is a fire in one portion of the forest, chemical and electrical signals are sent through that fungal layer, and they alert the other individuals within the forest. So if one portion of the forest is having a fire or the trees are being cleared, they send out a panic signal that communicates to the other individuals within the forest, and it's felt in other portions of the forest, okay? So it's sharing information, it's sharing resources. Now this mycorrhizae layer is the same thing, or is comparable to culture. That is what it is that we do as individuals. We think of ourselves as individuals, but in reality, we are connected through a vast network, okay? And that network is a storyline. It's our culture. It is how it is that we instantly understand who we are, where we belong, where we don't belong, what's dangerous, what's healthy, where we can have a family, who we can mate with, where can we feel safe, and where can we not feel safe, okay? And we do that through a variety of different ways. It is unconscious. I would argue it's largely unconscious, mostly unconscious. And we do it through hormone signals. And we also do it through behavioral signals and through transmission of information through language, art, all the different ways that we express ourselves, okay? Now, it's not all happy butterflies and bees. Going back to the forest in the mycorrhizae layer, this is a black walnut. And one of the things that happens through that network, now let me back up for a second. One of the things that is a reality, okay, I want you to understand that what I'm describing to you is a model. It's a very oversimplified idea of how this works. And I'm using this to just explain the concept so that we can start grasping it. But it's a little bit more intricate than that. It's more involved than that. All of those different individuals within the forest are sharing resources. You must have diversity in the forest in order to optimize your resources. But there are strategies as well within that forest for limiting resources to other members in order for you to be able to compete. And what you're looking at on the screen is a plant called the black walnut. This black walnut optimizes the mycorrhizae layer, and it actually sends chemical and electrical signals that both poison other plants around it or restrict access to resources. It is actively defending its territory and making sure that any of its competition doesn't have access to the same resources that it does, okay? It's a great example of what ends up happening with what I call, and what is known popular in this, the single story, the venom of the single story. This is how we do it. This is how we send poison down into our networks in order to limit access to other people within our community. This is something, like I said, that is largely unconscious. It's something that we get tapped into and it activates us. So here are some single stories. I just put the word out and you'll likely have a picture in your head, like Christian. How about gay or straight? How about poor or rich? With every single one of these words, I am sure that there is a picture that comes up in your head. And you may be thinking that you are more objective than that you can be more empirical than that it is not just a story, that there's evidence for those things. But they're not. They're not telling you the full. How about this one? This is a real active one right now. Republican and Democrat. Can't get on Facebook without hearing about that single story. Girl. That's something that has all kinds of ramifications to it. Ever been told that you throw a ball like a girl? The boys don't cry? How about this one? Fat. And there's always white and black. Every time that single story comes up in our head, it is in some way, shape, or form limiting access for both ourselves and the others around us to vital nutrients that we survive, which is community, which is belonging, which is a sense of safety, which is access to resources. And what's even worse about it is it's not only happening inside or outside externally, but it's happening inside of us as well. How many of us have been affected by that one single story that lands on our heads from outside of us and it gets absorbed into us like a poison goes through our skin and into our soul, and we believe it and we act out of that. So going back to those questions that I asked you, people think stories are shaped by people. That you cooked up that story based on those questions I asked you earlier in this presentation.
Did we lose Cecilia? She probably gonna pop back in.
Yeah, I thought I was the only one.
First one,
She
froze. I was
Froze
like,
for a while. Yeah, I think she may be having an internet problem on her.
wait, okay, I just wanted to make sure it wasn't
She's
just
back.
me.
Hey there. Well, now that's disruptive.
There you are.
I'm here. I'm here. Did we lose everybody? I don't know what it was. My network actually just decided it no longer wanted to listen to me, so I must be talking too much. So I wanted to talk about I have had experience with a single story. Okay, so 2006 and 2007, I was diagnosed with breast cancer twice. And in the process of going through my treatments for breast cancer, of course, lost my hair, of course, was a uniboob for about 1.5 years. But my metabolism, my endocrine system also responded to the stress of the chemotherapy treatments. And I had other underlying issues. And I became the largest I'd ever been in my life. And that was absolutely devastating to me. It was already, my body size was something that had worked its way in my head. But it was something that, with the addition of the weight gain and everything else that came with breast cancer, it just weighed on my head and myself. It's also affected the care I got. There was implicit bias that I experienced within my oncology care. I actually fired 2 of my oncologists over the fact that I was emotionally abused over my size. And it was very revealing to me. Because of the implicit bias, they missed a diagnosis with me. And not only did I have cancer, I had a tumor on my pituitary called Cushing's disease. And what Cushing's disease does is it increases the amount of cortisol that's being produced in your body. And I had between 5 and 7 times the amount of cortisol of a normal body. And that caused my body to balloon. Cushing's disease happens primarily to women. It happens primarily in middle age. And it is one of the most misdiagnosed diseases. And it's something that is misdiagnosed because of implicit bias of women who are large. So this created in me a lot of compassion and empathy for other people who experience this kind of bias in a medical setting. And when I was completing my degree, I wanted to do a research project that actually looked into how this was happening to other individuals. There's a massive problem that's happening within the United States, within our communities immediately, Texas, Harris County, and that is the fact that our Black mothers are much more vulnerable to either dying or suffering debilitating illness or physical ailments within the year following birth. So I decided to take a look at what stories are we telling about mothers, more particularly what stories are we telling about Black mothers, and what stories, when you're talking about Black mothers in medicine, you're alternatively talking about what stories are we telling about the practice of medicine and about medicine and power. It's a little bit of background. This is where the United States ranks in the developed world as far as maternal health. It bites. This is what it looks like in Texas. The orange line are African American mothers. The gray line are Hispanic mothers. Blue line are white mothers. And the dotted line is the aggregate between 2005 and 2014. There's another metric for looking at maternal health, and it's not just mortality, it is severe maternal morbidity, which means that there is debilitating illness or physical ailments that happen within 1 year following pregnancy. In the state of Texas, across all ethnicities, severe maternal morbidity rose 15% between 2007 and 2015. That's a story that's happening to mothers in general, not just Black mothers. Across the state of Texas, mothers are in danger. Unfortunately, in Harris County, it gets even worse. Across all ethnicities, severe maternal morbidity increased 53%. And in some of the zip codes of Harris County, yes, some of the zip codes in Harris County, Black women are suffering severe maternal morbidity of 3 to 5 times more than white women. Why? So I did an ethnography project. It was conducted between May and November of last year. I talked to 11 people, collected 15 hours of stories and interviews that were all transcribed. Part of this ethnography project, we took the ethnographies, myself and my community group that organized a health equity discussion day for the Preserving Communities of Color Conference in November. We took some of those ethnographies and put them together in a script, and they were read by volunteers in the audience to serve as prompts for our maternal health panel. So what I'm going to show you are 3 of the stories that were gathered through my project. First of all, I talked to Black practitioners. Black women who are also within medicine. And this is one of the quotes that I got from one of them. This is Charlotte. She was a midwife, or is a midwife. She's been practicing for over 30 years. And this is what it is that she experiences within the medical world as far as the way that patients are discussed. What is the story that's being told about patients? Now, for those of you who are in the medical field, I know you're already thinking, well, this is empirical evidence. I want to challenge you on that. I want you to see that word Black. I want you to see the stereotype. I want you to see the mass grouping and understand that statistics can lie. So within her experience, what she has experienced is that the patient is the problem, that patient is too fat, too thin, too Black, too problematic. And in her experience, she's been going to conferences for the last 30-something years, and every slide they put up about the bad and negative instances are connected to Black and African Americans. It's a reiteration, a retelling of that story. What about what's the reality, the story that's being experienced by Black mothers? This woman was one of the mothers that I interviewed. I interviewed 5 mothers. Astounding person. She has 5 kids. She is the first one in several generations on her mother's line to, well, no, actually, her daughter is the first one in several generations to not have a child by the time she's 16. And this is the story that she experiences, that she knows is around her when she goes out in public. One of the stories that she told me was actually being in a grocery store with a grocery cart full of cereal for her kids. And a man, this is down in the south side of Houston, who was in scrubs, wearing an ID from working in one of the medical facilities there, actually walked up to her grocery cart, looked in it, and made a joke about the fact that she needed another hobby instead of sex. And that's the reality of what it is. It's okay to think that, it's okay to say it, it's okay because that's the reality. What about with the white practitioners or the non-Black practitioners that I talked to? All of them were activist doctors. All of them were doing what they were doing because they loved their patients. They were passionate about what they were doing. These are folks that were very highly trained who had chosen to work in situations and settings where they were not being paid perhaps as much as their peers, but it gave them an opportunity to actually serve populations that they knew were sometimes not getting the best of care. This particular non-Black practitioner is talking about what she saw as far as why it is that African American women were suffering a higher severe maternal morbidity rate. And she is talking here about the story and how it affects the system itself, okay? She says it's probably the system. I think a lot of patients get lost in care. They get frustrated, it's confusing. The whole insurance and referring, it can be challenging for a person who doesn't have any knowledge of how healthcare works. And so it's easier for them to say, I don't understand. I just can't deal with it. And it's just a lot easier to just walk away. And I will tell you anecdotally, I volunteer for the Community Action Network for the Healthy Start program here in Houston. And I volunteered to go collect information on some of the clinics here in Houston that have capacity during COVID for women who are pregnant. It was difficult to get information and access to those providers until I revealed the fact that I was a volunteer with CAN. It was eye-opening for me. What kind of an experience are our pregnant mothers having when they're trying to access this? So everything has a story in it. Story, I've just become more and more sure and positive that story is the root of how it is that we exist as humans. And those single stories, when they come up, when we hear ourselves utter those single stories, and I know we do on a daily basis. Like I said, just open up Facebook and there it is. In our casual conversations with other people, in our diagnoses of just looking at someone and then trying to understand why their life is in the situation that it is. It's very easy to come up with that one word that sums it all up into that one single story. And I'm going to challenge each of us that are participating and on the rest of the world that to pay attention to those single stories when they come up and to challenge them, because everything's got a story in it. But if you want to change the world, if we change the story, we'll make a difference. So from this point, I'd really like to invite our 3 panelists to come up and actually talk to us about their own personal stories. I'm going to do a very brief introduction of each one of them because I want them to be able to share their own story and tell you more about who they are. The first person, hold on for a second. Let me back out of this. I've stopped sharing. Okay, good. All right, so the first person we're going to bring up is Crystal Chanel, and she is a certified peer support specialist and mediator. She's also a motivational speaker, a personal coach. She is an author, an owner, and CEO of Heavenly Service LLC, a marketing agency. She's also the single mother of 5. She's an avid social entrepreneur and runs a nonprofit organization called Purposeful Parents, which provides supportive services and resources to help parents raise healthy, powerful children and break the cycle of teenage pregnancy, incarceration, violence, and poverty. Crystal is essentially a human Swiss Army knife, and I'm very honored to bring her up. Crystal, you want to say a few things?
Hi, everyone. Hope you guys are having a great Saturday. First off, hope everybody's emotionally, mentally, and physically healthy after all the things we have going on from COVID and violence and all types of things. So it's awesome to, number one, be able to see you guys in person and hear you guys' voice that you all are doing well and we've been able to congregate together today. I count it an honor to be amongst you guys, as well as just to be able to see each other and see the smiling faces despite what's going on around us. So I'm just happy to be here.
So Crystal, how do you feel about maybe telling us a little bit about your story? You were one of the people that I interviewed for my ethnography. And tell me, can you tell everybody about what your experience has been, just recognizing and then acknowledging and confronting the single stories around you?
So I was born to set of teen parents. My mom was 16, my dad was 18 when I was born. So nonetheless, I'm the guinea pig kid. In addition to that, my dad was an addict for probably the first 13 years of my life. So there was a lot of violence and emotional abuse and whatnot concerning myself mostly, as well as my mom. My dad eventually got himself together when I got probably about 14, but my parents had also, when I was 12, had another set of kids. So while my family was healing from the effects of the abuse, I was still kind of lost because I had suffered so much trauma from everything that the abuse and the drug abuse and the violence had kind of overshadowed over my childhood. So I just was looking honestly for love. I met a guy who was a drug dealer, and we had some babies, and my life went fast really quickly. But when my kids started getting older, I started making some decisions that I wanted them to experience a better life. I wanted change for them. I did not, my great-grandmother, my grandmother, as well as my mom and I had all had kids at the age of 16. And I wanted to ensure that I made a decision that would invoke purpose and change for my kids. I knew that I had created a person that wasn't who I was purposed to be. And I wanted to shift that so that my children would have an opportunity for better. So life kind of had its way in the process. And just the stories that were around me, number one was just accepting that I deserved better, accepting that more was out there and available to me, and that so much hadn't happened to me that I couldn't shift and come back from it. So trying to work on being a better me while working, and then also being a mom, making the decision to shift out of a relationship that was not something that was conducive to where I was supposed to be and who I was supposed to be, and just making a decision to be okay with parenting on my own, which was a rough decision, but it turned out to be really great. And I decided to, as I was raising these kids, the point of becoming a nonprofit was important to me because I felt that there was no opportunity for a great moment of change for me. And I wanted to be what no one was for me, because even when I decided to make the shift and the change, it caused some friction in my family because I was ready to tell some truths that my family was not ready to receive. In addition to that, even though the drug addiction was no longer an issue, my parents had gotten into the church and my dad was now a counselor and a preacher. there was a lot of conversations that they were just not ready to have because it took them back to a place that they hadn't fully healed from, they had just buried. So my healings sometime was a direct reflection of a place that they weren't ready to receive. So I made the change, and I was prepared to then make that change by myself because no one really got it that was around me. So those stories that were around me was like, yeah, this happened, but you need to get over it so that we can be okay and we can accept the lie that we've told to make ourselves feel okay. And so I created the nonprofit because I know that I'm a strong person, but I know that there are a lot of people who weren't as strong as me, and some people needed that support. They needed that help. So yes, we do give items to people, but we give them a safe space to heal. And that's important. I think when Cecilia talks about the body and all these other things, I think when the mind and the heart heals first, the external changes could manifest properly because we first have to come to grips with what has happened, the acknowledgement of that. Number one, I was abused. I watched my dad shoot up. My parents was not okay with my healing. I had more babies than I knew what to do with. And then to accept the fact that, you know, I was a teen mom and didn't know what the heck I was doing. But then now at a place where I've made some decisions to be okay with the truths, the things that I messed up, we give those moms those places to heal, not just, okay, well, we're gonna bash the person that we had kids with. No, I'm gonna make some decisions to figure out why I chose him in the first place so that I can stop the cycle of constantly bringing people into the world, stop the cycle of abuse and trauma and all these other things. So I made those decisions to bring healing to my community. And I felt like the best way to do that was to be honest and transparent and to be truthful and be open to them, because there is no proper healing when we cannot be open. So we call it getting naked. If I stand up still and I get naked, then it makes it comfortable for everyone to get naked too. And then now that we're naked, we can operate and wear the clothes that actually fit us and not the ones that we decide to wear even when they won't. So currently I do have 5 kids. My oldest daughter is in school at TSU for her doctorate. She's a P2 in pharmacy school. My 18-year-old is a cosmetology student. She's about to be an esthetician. I have one leaving for the military on Tuesday, one preparing to go to college, and then I have a 7-year-old. So we have a lot going on. But what I did not do that I would encourage everyone to do, even my families and even anyone that's here, I was so busy healing and working and fixing things that I never took a moment to just exhale and look at how far we've come. And during quarantine, I've been able to do that and to look at that, you know, I pretty much did some really good stuff. And not to pat myself on the back, but just to be able to see that the seeds that you've sown have executed something really good. And to watch my children transition in quarantine to be learners that were e-learning only, and watch my college student go into transition and lead the group of other pharmacy students. It's like, okay, you've really done something good. And I think if we can teach that to the community and people could get outside of the mindset that we've been taught and the stories around us, I think that healing would be a real place if I decide to start with me. So yeah, that's me in a nutshell. Is that all you wanted to hear, Cecilia? I'm trying to keep it light.
It's all right. We're going to dig a little deeper into that, but I'd like to go ahead and bring on one of our other panelists real quick too, so she can join the conversation. I'd like to introduce you, Chenna Jones-Conley. She's a family medicine resident at the University of Texas at Houston McGovern School of Medicine. She has an MBA from Baylor University, Hankamer School of Business, and a medical doctorate from Wright State University, Boonshoft School of Medicine. She's passionate about eradication of health disparities, and her research interests are SIDS, maternal child health policy, disparate health outcomes impacting women of color and children, building resiliency in children of color, and the marriage of medicine and public health. She's also the co-founder of the Ajana Conley Foundation for SIDS and the co-host and creator of a web talk show called The Den. I'd like to introduce our second Swiss Army knife, Chenna. Uchenna, are you there?
Hi, yes, I'm here. Can you hear me?
I can definitely hear you. How are you?
I'm doing well. Thank you. How are
You're
you?
very welcome. I'm good. So tell us a little bit about yourself and your story. I tried to shorten your bio so I didn't give anything
Okay.
away.
All right. Well, first, Crystal, you are amazing. Just want to let you know that.
Mhm.
An inspiration. So, a little bit about me. I guess I'll start with what defines me personally. And what defines me is actually being a mother. I'm very proud of that. And in that same breath, I am actually a mother of a child that is in heaven. And she was actually my firstborn. Um, and when we talk about healthcare disparities, I never thought that I would be a statistic, if you will. I was living my life with my fiance at the time, now my husband, planned to have a child. Everything was going, just graduated from graduate school. I was living the quote unquote American dream, going down that path when I say a train wreck tragedy happened, not literally a train wreck, but my daughter, 2 weeks shy of her first birthday, died of sudden infant death syndrome. Until that point, I never imagined anything like that could happen to me. I'm a very cautious person. So I knew about SIDS and everything I did right, if you will. She was almost one. She was walking, talking, doing everything. So when she died, I know my life turned upside down. And it is the single most defining moment that from that day forward has guided and navigated me to where I'm at today. Um, I come from a single parent household. There are 5 of us in the house. My mother was a hardworking mother. And however, I didn't realize some things about my mother until I was older, but my mother had experienced trauma very early. Her parents, my grandparents were abusive, which I didn't know, to each other. And my mother's first husband committed suicide when they were in college. And not knowing a lot about my mother, I was very resentful about the way I was raised because she was which I know now, she was traumatized, right? But she wasn't a very nice person. And we struggled a lot. My mother was educated. She went to Texas Southern as well, Crystal. Um, but she just worked really hard to take care of us. And so I myself didn't realize how my childhood was because I always figured I was better off than most. But we didn't have running water a lot. We ran from the rent man a lot. We didn't have a lot of food. We had to go to my grandmother's most weekends so we could eat. But even through all of that, I never felt that I was traumatized. I just lived life because I'm a very glass half full person. But what I knew was that I would never want to be a single mother, number one, which is nothing against single mothers for me. I never wanted to be a single mother. I wanted to have my children's fathers in the house. So I had this picture and this image of my life that I've tried to paint, and I tried to paint. But when my daughter died, everything crashed. Just thoughts. I actually realize now I dissociated for about 2 months. I can't recall 2 months of my life. But then I started thinking about what did I do? How did this happen? In the process of grief, I went through what happened, and I realized that I actually went through a very traumatic delivery, which I tried to bridge that to maybe there was something wrong and my daughter died, but I did. My pregnancy was actually fine. It was a very good pregnancy. I read what to expect when you're expecting I had a case manager, I had all this stuff. So I never once thought that I would have any issues. But when I got to the hospital, I quickly realized there were issues. And the doctors really didn't, I think I was more of a subject to them. I know now, going through residency and medical school, that I had like 20 people in the room with me all the time, which meant those were probably med students and other residents. And just wasn't the best experience. I don't remember a lot of it, only because once I decided to have drugs, I forgot. I was in and out, but I'll say this: the doctors waited, and things were not explained to me very well. I ended up having a C-section, an emergency C-section, and at that time, I didn't realize that that was going to impact my childbearing for the rest of my life. I wanted 5 children. So, but having multiple C-sections, that decision was taken away from me. And it was just that was very traumatizing. And I realized then I was a number, or I was just a person, and there wasn't a lot of care. And I still didn't appreciate that it might have been because of the color of my skin. Me losing my daughter, people looked at me, and she actually passed in childcare. And it was so interesting. We were in Fort Worth. At the time, the president over SIDS said that they worked really hard on the autopsy, because we didn't get results back for almost 3 months, because they couldn't believe that it was SIDS. And I'm not thankful, because it's very traumatic for my child care provider, but I'm happy Jonna wasn't with me, and that day she was supposed to be with me. Actually, I was on my way to surprise her, to take her to get some cake early for her birthday. But had she been with me, I would have experienced investigation and more trauma. But I was looked at a certain way, because I didn't realize this at the time. I was a Black woman. It didn't matter that I was a Baylor graduate, undergrad and grad school. It didn't matter that I had a job at a top 5 consulting. None of that mattered. But the way I was treated and looked at was as if I did something wrong, or maybe it was expected, or the shoulders were shrugged, because, oh, she's just a Black woman. And that reality over the years, just it angers me, but it has led me to where I'm at. After Jonna passed, like I said, there's a lot in my life I didn't remember, but what I do remember is that I could no longer travel. My company, I was a consultant, and I couldn't travel anymore. At the time Jonna passed, I found out that we were pregnant, expecting our 2nd child. So, and by the time I found that out, I'd already lost almost 25 pounds. And I'm not a very big woman at all. And I had to make the decision whether I wanted to live or die. And it wasn't live or die in the sense that I was going to kill myself. It was live or die that I was going to pick myself back up and live. And through the grace of God, my son that I had, he saved me, because I was very lost. My older sister, who is my role model, she told me that she was so worried about me. I had my best friend stay the night every night, even though my husband was there. It was very interesting. I realized men grieve differently. So we grieved very separately, and we didn't understand. I'll speak for myself. I didn't understand his grieving process. I felt like he moved on. So I was very blessed to have a strong support system. So I fast forward to where I had my son, and I could not go back to work. My company I was very blessed. I worked for Accenture. They transferred me to Houston because I felt that I needed to be closer to my family. But I didn't have the wherewithal to leave my child. And so my company and I came to an agreement. So I left. They were really good to me, but I had to leave. And at that time, I started working with a SIDS pediatrician. Southwest SIDS Institute because I was just so confused. And for me, I have to understand why things happen. I have to know because I did everything. Jonna slept on her back. She was rolling on her, she was doing on her own thing. No one smoked. I mean, none of the risk factors applied. So I couldn't understand. That's how my brain works. I have to understand things. So, but working with the SIDS pediatrician, working with her and my son, I got very involved in just understanding what sudden infant death syndrome was, and then actually just understanding what infant mortality was and how Black children, babies, are at a higher risk of dying just because they're Black, basically, right? Coming from mothers that are Black. And that pained me. And then I was told by my mentor at the time that she couldn't reach all of the women, reach them because she felt that there was a barrier because she was a white woman and what she was saying was counter to their cultural beliefs. So I stepped up and I said, with her research, I said, I'll help. And so I did, and I began to learn a lot. And that's when I realized, you know what, we need more Black doctors so that I could be a role model, not just a role model, but I could be there for other Black women that were searching for others that understood them. And so I started my journey to becoming a doctor, and that was 2003. And because I worked and had at that time a child, and shortly thereafter we were expecting our third child, I started taking a class a semester and worked at classes. And so that whole journey of prerequisites led me, from 2003 to 2009. And then I got into medical school in 2011, and now I'm here in residency. But during that time, I got very actively involved in Houston. My husband and I started the John Connolly Foundation for SIDS because I wanted to be a resource and just a source to raise funds for the effort. I met a lot of I don't know, June's on the phone, but I met a lot of women that had the same passion that I did. I wanted to figure out a way where Black babies initially weren't dying just because they were Black. And in that journey, I realized it didn't matter what my socioeconomic status was. It didn't matter what education. It didn't matter where I came from, who my family. It didn't matter that just being a Black woman and the stressors I have faced, even though I don't see stressors, I really don't. I just live and I fight through because that's just who I am. That still impacts me. And that leads me to be leads me to have increased risk for everything, which for me is, I don't accept that because I feel like I can control who I am. I can control my life. Even with exercise, I try to do everything right, and that doesn't matter because I'm still at a greater risk. So I've dedicated myself. I say I turned my tragedy into triumph because I've dedicated my life to Ujana's life and making sure, I try to make sure other people don't experience what I've experienced. And I envision a world where Black women and other women of color aren't penciled out automatically. But in my experience, I learned that microaggressions, since that's the buzzword now, persists through everything I do, in every way, in every place I go, and you can't escape them. And people do not realize, the doctors don't realize what they're doing or what they're saying and how it actually comes off. Just like the young lady that was approached in the grocery store with food in their basket, the judgment is there. If I want to have 5 children, I can have 5 children. I mean, granted, I'm going to make sure I can afford them, but at the end of the day, if you want to have what you want, and no one should judge you and say, that you can't because you're a statistic or you look like a statistic. So that pains me that it still exists. And over the past year, I know this is probably very controversial, but I feel like to really combat healthcare disparities for Black women need to be treated medically by other Blacks. I really am feeling that in my heart, and I know I don't know. I'm still wrestling with that thought because that's huge, right? That's very huge because I know there are many white doctors, Latin doctors, that are great doctors, great practitioners, whether it's a doctor or nurse. But I really feel like in implicit bias, hirsutism, there's so many factors that contribute to how people are treated. And when stereotypes or preconceived notions about people are automatic factors in treatment, women of color, Black women are always going to be seen in a different light. So when they walk in the door, they're seen as Black women and treated as Black women. And to some, that is not giving them the best treatment or the best care, if you will. But I don't know. I just fight. I live every day to make a difference. And once I'm finished with the residency, I left off that I also worked for the Houston Health Department. I was their strategist and I became their maternal child health specialist for a little while. And they're working to groom me so that I can come in as a physician in leadership, because I really feel that, especially when we're talking about healthcare, that public health is essential, and that doctors should have a public health vantage point, because you don't just treat individuals, you have to treat families, you have to treat communities if you really want to, as you say, get to the fungal layer, Cecilia, if you really want to impact change and make this world healthier, you can't just look at individuals and expect to make a difference. It's all about the community they live in and the conditions they live in, because when they leave your office, they're going back into those communities and back into those conditions. And without changing them, you're not really changing anything. We're just actually still just diagnosing and treating. And the prevention component is so sorely missed. So, yeah, that's me in a nutshell, I think. But I'm still growing, I'm still learning.
Yeah, no, absolutely. Very, very grateful for your story. Thank you so much for being here today. So before we continue the conversation, I want to bring in one more person. Very excited to invite Amelia Everett to our panel. She's a primary care physician here in Houston. She earned her master's in public health from the Johns Hopkins Bloomberg School of Public Health, where she focused on community-based participatory research in social and behavioral sciences. She earned her MD from Baylor College of Medicine here in Houston. She's currently the co-president of Doctors for Change, an advocacy organization that mobilizes membership to engage in policy, education, and service, all focused on improving the overall health of Houston's most vulnerable populations. She's also a leader in the Third Ward Health Collaborative in Houston's Third Ward. So, ladies and gentlemen, I would like to introduce you, Amelia. Amelia, are you there?
Yes.
Hi there.
Hey, can you hear me?
I can hear you. I
Okay,
can see
great.
you. I can hear you.
Well, first, thank you both, all of y'all, for such powerful stories. I am eternally grateful to you, Cecilia, for inviting this conversation, and also inviting the challenge for me for some pretty deep reflection on how not only, my personal stories, but then also how I practice medicine, and what that looks like moving forward. Today, I am not as eloquent or spontaneously well-spoken as my preceding speaker, so I wrote out some thoughts. If I get too long-winded, please feel free to cut me off. And then, and I did, mostly this reflection is on medical education and the practice of medicine. I'm coming at this as my story as a physician. And then just in listening to y'all, kind of that, it brings to mind the fallacy and the illusion that physicians have. I know there's like a God complex that a lot of us deal with. But then also along those same lines, we run the risk of convincing ourselves that we are in control of the stories, not only of ourselves and our professional trajectory, but also of our patients. And I think that puts their health at risk. And I hope to get into a little bit of that with the following words. So if you'll indulge me, as a physician in training, we're inundated with information about how bodies work, and we're trained to think, more importantly, when they don't work, how to, quote, fix them. We pick them apart, quite literally, in an anatomy lab, but also in the rehearsed ritual of the history and physical exam. Through this exercise, we dissect a person's health into organ systems and come up with a general assessment and then a plan on what we think is best for them. Our assessment is often started with a series of just data points, a one-liner, if you will, that quickly sums up a patient for us and for our colleagues who will later read the medical record or be presented to. These often include race, sex assigned at birth, age, weight, and a litany of problems previously identified with their health. Ironically, a patient almost has zero say in how they are summed up in this one-liner. Their life story is boiled down to a series of descriptors that may or may not be even part of the top 20 adjectives they would choose to describe themselves. In this way, as physicians, and I do it myself, I take over writing that patient's story. With a few simple words, I frame a patient's background and put myself and future physicians at risk for making wild and dangerous assumptions about their life choices, who they are as a person, and what they may or may not have done to get to this point where they're sitting in front of me. We're taught that these data points should kind of may be helpful. They trigger important medical associations, like risk for cancer or chronic disease. But too often, they're triggers for implicit bias, as a lot of my colleagues have spoken to, because the stories we have heard and we've internalized through our upbringing and our education. We would think that the worst labels to have in a one-liner would be, non-compliant, as it would prime the physician for a difficult and often fruitless interaction, maybe tossing in the towel before it even starts. And until the shift to patients or person-centered language, homeless, alcoholic, or other deleterious health behaviors were used to represent and describe an entire person. I would argue now that one of the most dangerous words in that one-liner is Black. These words trigger an implicit bias in all physicians that lead to unrecognized postnatal complications in Black mothers, undertreated pain in Black children suffering appendicitis in the emergency room, untreated heart attacks, and eventually, and rightfully so, a mistrust in the healthcare system. I believe this is because, one, we cannot make an assessment of a patient's health using only a few words without, every time we do it, recognizing the shortcomings and the danger of the system. And two, we need to reimagine what these words mean and change the story behind them. As an example, it was beaten into me in training that the African-American population has a higher incidence of hypertension, and if your patient is African-American and they have hypertension, they need to be treated with this certain drug. I have to admit, I haven't done the most extensive research into the genetics and epigenetics of this, but I have to question this dogma. Why is it that there are higher rates of hypertension in African-American populations? Is it something intrinsic to their bodies, written into their genetic code, or is it the effect of being Black in a racist society? If that's the case, we have to reframe how we approach these quick associations that we make just hearing that one-liner. There's a shift now in medicine towards the inclusion of social determinants of health, access to food, housing insecurity, zip code as, quote, vital signs. And the idea is to prompt the practitioner to consider these as much as risk factors for health outcomes as like smoking or having high blood pressure, in addition to barriers to care like transportation and income. It's one step in the right direction of representing a broader perspective on a person's whole health, a more complete story, if you will. If in medicine you can quantify it and name it, that's the first step in addressing it studying it, what have you. We can create a referral system to food banks. We can give transportation vouchers. But I keep asking myself, and more so in recent days, how do we address racism in our practice? Is the first step changing the association with the word Black or African American made when we first hear that in the one-liner? What if the associations made with that descriptor shifted from heart disease, higher pain tolerance, lack of medical understanding, to instead at risk of police brutality, worse maternal health outcomes, chronic stress and trauma, and even yet likely to get misdiagnosed and mistreated by medical professionals? Instead, naming the medical system as the problem instead of the patient themselves. What if the word were a signal for being at risk for systemic racism and the health effects that causes? A risk factor for adverse health outcomes, not because of an intrinsic quality of skin color, but instead because of the external stressors inflicted on a population or an individual. How would that change the stories or the assessment we write about in our patient charts? And how would it change the approach we take to their care? The final part of the note, the problem list, creates a plan to improve or maintain a patient's health as deemed necessary by the physician. It's unfair, I think, that a person's interaction with the healthcare system, arguably their, quote, picture of health, is conceived of as consisting entirely of a list of problems. A person, a patient, is not a collection of problems to be fixed by their physician. But that is how it is framed in our storybook, the patient medical record. We study for years and strive for a lifetime of learning in order to both recognize and fix those problems. We want to have the answers. I want to have the answers, and we often struggle to admit when we don't know something. Our success as physicians is dictated by numbers and having the answer ready. Medical training and practice reinforces a story that the physician has the power of knowledge and access to cures, and that for some reason the patient must earn that the physician share those with them. The truth is, we are often trying to fit patients and their problems into a limited number of illness scripts that we know how to prescribe or surgerize our way through. I have found in my own practice in primary care, and I can't speak to subspecialists or other practitioners, but none of my patients follow these illness scripts. People are nuanced and complicated, and so are physicians. It's an enormous privilege to be able to speak with a patient when they are at their most vulnerable. But I also have to recognize that I too am at my most vulnerable when speaking with patients. I may not have those answers that I'm so wanting to have. I may also not, at least initially, have the capacity to fully comprehend all the factors contributing to their health. I may not be able to tap into their story right from the get-go or even ever, and I have to work with that. I can be there to listen to them and to help them define and address their own health goals. I can help them write their own script. I can also work to expand the perspective of that problem list to beyond the clinic walls. Then it becomes my responsibility as a physician to do something about it, because my story and the story of all doctors starts with the Hippocratic Oath to do no harm. And I feel that ignoring social injustices and health inequality is doing harm. It is often easier to apply population statistics and correlations to the health outcomes of individuals, but it's also a dangerous practice. A person's health is created not only by their medically defined problems, but also their life experience. As a physician, I need to practice every day reframing, rewriting, all of that stuff. My patient is not just Black. They have experienced being Black in America, and if I'm deserving of it, they will let me know what that has meant in their life. Unfortunately, the risks associated with those kind of one-liner words with race, immigration status, housing security are not entirely intrinsic to that one data point, but dictated by the society in which they reside. Health is not defined by the terms or diagnoses given in a clinic or hospital. It is determined by the community, society, and environment the individual inhabits. As a physician, I need to practice humility in the not knowing about a specific illness or a treatment, but also in the inability to truly comprehend and empathize with a patient. The latter I may be able to overcome with a little research, but the former will only be overcome with a lifetime of listening to, and in doing so, getting closer to understanding these stories of individuals, of communities, and also letting those shape my own story. So, thank you.
So powerful. Thank you so much, Amelia. Really appreciate it. The three panelists that we have this afternoon, before we go into questions and all that, I just want to reiterate how incredibly humbled I am by having you join me in doing this. And I'm very grateful for you being vulnerable enough to tell your stories. One of the questions that I have for you is what are the single stories, what's the single story that has affected you the most as you've come to be who you are? What is the single story that you've had to push at from inside you, that you've somehow ingested, that you needed to work against in order to be more of who you are now today? Crystal, you want to start?
I can, thanks. So I would say internally, it's just the mental defeat, feeling defeated that you can't move beyond where you were born into, what you were growing into. I was so fearful of being an addict. I think I wouldn't, as a teenager, friends smoke weed and I couldn't do it. I was so fearful of being a drug addict, but just being able to move beyond what you've experienced. I think there were times when I know, going to college and graduating and just constantly being pursuit of new certifications or new degrees, or watching things transpire in my life that were really positive, but not being able to be happy for myself out of fear of either being broke or broken or lonely or whatever for the rest of my life. I was just in constant pursuit of new ventures because I didn't feel that any set of success was ever enough.
Wow. Amelia, what about you? How would that work out for you?
I guess that internal story, and I've been trying to reflect on this a little bit too, just in recent days, has been the one of overachiever. So I was firstborn. My mom is a lawyer. My dad stayed at home with us. So there was a shift in our kind of family dynamics and the stories that were told in my house around the role of husband, wife, earner, not earner in that sense. But then there was also the pressure to, I guess, live up to my mom's standards in being the high achiever and being, the one with multiple degrees and income, things like that. And I think so much of the focus is that outward recognition, and that's struggling. And now I'm in my relationship with my mother, I'm coming to realize that she had to sacrifice a whole lot of kind of what we, define as success in family and mental health and things like that. So working against that kind of drive to define my worth as, the degrees on the wall or publications or what have you. So, yeah.
Wow. Uchenna, what about you?
So that's an interesting question, first and foremost. I've never thought about that before. So when you asked it, I was like, oh my goodness. As I'm happy you went to Amelia instead of me first, because as she was talking, I thought she actually triggered some things for me. So I'm gonna say there are actually, I guess, two things, two inward stories, I guess. I didn't realize, I don't know. But the first is the kind of trying to make sure that I don't stay angry with my mother, and to have a relationship with her, because as I get older, I realize she actually did the best that she could. And as a parent, you have no idea what you're doing anyway. And then on top of that, dealing with trauma, dealing with the death of your first, just a lot. But I didn't see that at all. And just a lot of resentment, and now trying to develop a relationship, because I think it's important to have that relationship. And also with the loss of my daughter, my only daughter, because I have 3 sons now, I realized how important the mother-daughter relationship is. And I don't know if I'll ever get it with her, but I can work to have something close. But that leads me to the second inner struggle. It's not actually an inner struggle. I guess it's what I've always had in the back of my mind that I want to strive to. So I have a older sister who is like my mother, to be honest. But my older sister is an amazing woman. And I always wanted to be defined by who I am as opposed to being her little sister. And that was at a very young age. I think when I stepped foot in a high school, I really quickly realized that being her little sister was a shadow, and I had to break out from that shadow. And I still, at the ripe young age of 47, still have to. And I have to grow to, I realized she was a great role model, but I didn't realize that. It was always me trying to do my own thing. She's amazing. And there's like nothing that she can't do. So anyway, so it's me just being okay with being her little sister, because it's actually, as I've gotten older, it's actually it's a joyous thing, when someone says to you, "Do you have a sister? Is your sister such and such?" So, and I'm like, yeah, that's my sister. But I've always tried to create my own identity. So I guess it's just, for all, it's creating an identity that's my own, and walking my path the way I want to walk my path, and I continue to do that. So.
It's powerful. So in the presentation I was doing, I showed the picture of the black walnut. And one of the things about the black walnut, as a metaphor for everything we're talking about, is that the black walnut does not have intention. The black walnut's just a black walnut. It doesn't decide it's going to poison all the other trees around it. It doesn't sit there and plot which tree it's going to take out. It's actually just being a black walnut, and this is part of what happens. And I try to think about that when it comes to implicit bias. The anger I've had towards medical practitioners in my diagnoses of Cushing's and all that, I've had to detach from the idea that it was personal, that it was something that was actually more systemic. And I would like to hear from each of you, whoever would like to speak up, talk about the experience of actually, how hard is it to separate from systemic racism and personal racism? How have you been able to come to a point where you can recognize the two? Are they separable? Is it something that, tell me what your thoughts are on this.
I think that racism is something that is taught. It's how people grow up. I grew up in Louisiana, and a lot of people are what we call mutts. So you have a lot of everything going on. When you talk about Cajun and Creole, it's a lot of mixture of different races and whatnot. So all the kids, like in my age group, the kids grew up with knowing each other and having a cousin that we shared no matter what color you were, because somebody was somebody. And then on the elder side, my great grandmother was half white because her father was a slave owner, and her mom was what they consisted of the house, a person who worked in the home but was, I guess, raped by the man, and then ended up having a child with him. So, I think a lot of it is taught, but one thing that I've learned in the growth and development of myself is once you know your identity, it really doesn't even matter what people think, feel, or say concerning you. And there's a lot that I don't even really need to address, because I do think of life purposefully. And if I take the time to get off of my purpose porch, as I call it, and bark at every passing car, then I miss the journey of the beauty of what I'm supposed to experience in my life. I think that that's their problem. And when I choose to take it on and address certain things, it's like, okay, I'm Black. Obviously, you can see that I'm Black. I'm a woman. I may have gained a little weight. I have PCOS. It's like, okay, I'm working toward that journey. But why does that need to be a discussion or a situation? Because once I start to address it with you, then I've then took the jacket of your negativity and your drama that you face within yourself because you have not taken the opportunity to understand your identity. Because, you know, my great grandmother's white, so I can't even not have an issue with white people because of that situation. And I have cousins who are pure Indian. So it's like, you know, how do I even address that when people are talking to even my counterpartners that are Black? I'm like, you know, sorry, my great grandmother's white, so I can't really partake in that conversation. But I do think a lot of it is a lack of identity, honestly. People just don't know who they are. They don't understand their purpose. They don't know why they've been put on the earth. So they're just running around, running off at the mouth and really foolery behavior because they lack identity and they're just spewing that on other people.
Thank you very much. Yeah. Amelia, Uchenna, anybody want to chime in?
I'll chime in. So I was raised, when I talk about my mother, I don't want you to think that's very negative, but my mother was in college and in grad school though, when I was young. I was raised at Texas Southern University, and my mother was very militant and part of the movement. Her best friend was out. Anyway, it's a lot, but I say all that to say I've always been very aware of who I am and what I am. My mother is all about Black power. So, but then she moved to A-Leaf in the 70s. And if anyone is from Houston and was around then, A-Leaf in the 70s and the 80s was a very diverse, really the 80s was very diverse. So I say that to say that even though I knew about racism, I think I experienced individual racism one time when I was in 6th grade. I didn't experience systemic racism in education. Well, because number one, my sister came before me, and she ended up being one of the best athletes in the world, magna cum laude, Rhodes Scholar, right, all that, right? So our family was looked at a certain way. I came through, I was one of the top athletes in the state. I was National Honor Society. So I say all that to say I was never systemically, right? Because I learned now that how systemic racism is in the schools and how we get to feed her to, so all of that. But honestly, as a child, I knew individual racism. I didn't know systemic racism. And being in a diverse community, I did not experience individual racism. I didn't experience individual racism until I got to Baylor University and everybody was segregated. And me coming from a diverse background, I had white friends, Black friends, Asian friends. I mean, heck, and they were just friends to me. But I fielded a lot of questions at Baylor. I realized that there were pockets. The Blacks were here, the whites were. And I'd never experienced that until I was 17 years old. People would ask me, "How is it to have a white roommate?" And I'm like, "What do you mean?" Right? I'm so confused. My brother from not the same mother. He's white. He came to Baylor and we're thick as thieves, and they're like, "What?" So that was the individual side, and it's interesting because it came from Blacks. But Blacks, we have intra-colorism issues and all this other stuff. So I was very not understood for a while. So that's on the individual racism side, meaning once I got to Baylor, then I experienced, white. I'm saying white because in the 80s and the early 90s, a lot was mostly white and Black. Even, in universities, you had some Latino, but I just was more white and Black. And I was in class, in sociology class, and a girl said, I've never really met a real Black person until I came to Baylor. And, what's a real Black person? I didn't know what she meant. She said, like Cosby. I'm like, no, I don't understand. She goes, well, I have maids and butlers. By the way, she's from Highland Park, if you know that, in Dallas. But so understanding that I'm seen a certain way that I'd never experienced in my life. And it was an outrageous moment in sociology. I should tell you that. But that was the first time I'd ever experienced that and realized that when people see me, they automatically think a certain way, right? But I found out that my sister, because she's older, when we first moved to A-Leaf, she'd experienced that kind of subtlety, subtle, and we call them microaggressions now, right? So then let's fast forward to systemic racism. I was very fortunate. I don't think going through college, I didn't experience it. Let me say that. Going through grad school, I didn't. It wasn't until even getting a nice job, I didn't. But it wasn't until medical school that I truly understood microaggressions. And I didn't even know that was a word then, right? Where I'm on rounds and my attendings don't even look at me or engage in conversation with me. And when they do, it's not the same type of conversation as my counterparts, right? And how I don't know if I was expected to succeed. I'd never been in a space or a place where I wasn't, that was a question. I was always going to succeed. But it seemed like there were like statistics at play. Well, the odds of this, and so just understanding that, and now fast forward, I mean, just everything I do, I pay attention with my children. All the inherent racism. So I say that my intern year in residency was in California at a university called Charles Drew. It's the first and only medical school made for Blacks. Charles Drew, a famous doctor, right? And he made a medical, it's an HBCU, which is in California, which is unheard of. But I learned last year all the social injustices, and I learned so much about how systems are in place. I mean, I know how it is in the legal system. I'm not, but how systems are in place to be obstacles along the way, and to how do I say it? Make people feel less confident to where they want to give up, if you will. I've never been that person, so it's never been a part of me, but understanding that there are people that do want to give up. I'm the person that people come to for counseling, and I've had to tell a lot of my Black counterparts and my women friends, you can do this. You can do this. I don't care what that professor says to you. I don't care what messaging. So I think, how do you combat it? I say you call it out. That's what I do. And starting the talk show that Cecilia I mentioned, there are 4 of us, 4 women of color, and it's designed to give people a voice. It's okay to speak. Use your platform, because the only way we're going to even put a dent in the race and racism, those implicit bias, the stereotypes, is calling it out. I mean, I've gotten in trouble my whole life because my mouth gets me in trouble. Things just come out. So I'm good at that, but I know a lot of people aren't. So I just say, you have to call it as you see it. You call people out on the racism, on the biases, on everything. And because sometimes you can have a real conversation when you call something out to someone, because maybe they actually didn't realize, I give you the benefit, but maybe you actually didn't realize that what you were saying was offensive, or what you were doing was offensive, or the system that's in place is offensive. I mean, now, anyway, I could go on about that, because I actually took my sons to the protest yesterday. They were on TV on KPRC and 26, and they spoke in front of the protest. So I think calling it out, being involved in making sure that people understand and I understand this whole white fragility, but I think it's important because we're all fragile, and you have to break the fragility to build a strong foundation. So for me,
I love that.
You just call it as it is. Make people uncomfortable, because there's a saying that if you're comfortable, you're not growing, but if you're growing, you're going to be uncomfortable. So you're only growing when you're uncomfortable. So I say call it out. And on the opposite side, if you don't understand, okay, so I'm gonna put a caveat. Make sure the questions you ask aren't offensive ones, but ask a question. But before you ask a question, do your own research too. And if you don't truly understand from a person of color, a Black person or Latin perspective, then you ask the question. Don't be afraid to ask a question. I mean, word it a certain way, but that's how dialogue begins, and that's how change starts to just happen, because we have a lot of, as Crystal mentioned, with slavery, we have a lot of hate and vile and racism that just is in the fabric of our being in America. And it's going to take a lot to change that foundation. And the only way we can do that is through conversation and being honest and open and, quite frankly, uncomfortable.
Yeah, I love what you said about us all being fragile. Amelia, would you like to add anything?
Just a few thoughts. So part of the question too is, can you separate the individual and can you separate individual and systemic racism? And I had never thought about that. You know, if you can, we tend to discuss it as two separate terms, but I'm coming to see it as, I mean, you can't separate them. So with systemic racism, my role in that is being complicit, right? It's not speaking out when I hear a wrong, see a wrong. It's not doing anything. It's not, you know, voting in local elections even. Or it's not listening. It's waiting for my next response to be that sensitive person in the conversation when I'm having a conversation with somebody who has a different background in anything than me. And it's a lot easier, right, to be an individual as part of the system in that. I think it's a lot scarier to think about it that way. It is for me, and I bet it is. And that's why it's nice to kind of, when we talk about populations, I mean, this happens in the news, it happens in advocacy work, right? People latch on to individual stories a lot more than when we talk about groups of people, because it's easier to say, me as one person, I can't do anything about that. Or, you know, that's just the way it is for that group, when that's not the case. And so I think challenging that dichotomy between the two is important for all of us. And I will just say, being one who is always wanting to learn more, I think calling out racism, using that word, right, is not something that people are generally, I can speak from the white perspective, right? In trying to be sensitive and PC and all of that, we don't want to use the word Black. We don't want to use the word racism. We don't want to engage in those conversations. But I recognize too, it is not the other people's responsibility to teach me. It's my responsibility to be open when those moments of learning are, you know, I have the privilege of sharing in them. Yes, I can invite them, but also it's not me demanding it and then receiving, if that makes sense.
Mm-hmm.
Yes, that's my 2 cents.
I get it, totally get it. We've got a bunch of minutes right now, and so I want to ask the three of you, do you have any questions for each other or for our audience out there as far as things that you would like to hear from folks? Do you have any questions? I want to make sure everybody has an opportunity to be the quiz master.
I don't have any questions.
All right, I'm going to throw it out to all of our friends online. You can unmute yourself, or I'm not too sure how to raise your hands, but if somebody has a question for all of us, I'd really love to hear it, or a reflection on some of the conversations that we've been having. Anybody want to step in?
I'll ask a question. Thank you all for all the time you've given and for, you know, engaging in this conversation and sharing your stories. And Cecilia, thank you for you know, facilitating. Because we're talking about stories, I think a lot about, and I'm really interested in hearing all of your thoughts on you know, how do we break out of this space where you know, people only validate the right type of story, and the story and the narrative that ends in the kind of space, right? So we have the stories of triumph and the stories of overcoming, and where do we, how do we help to create spaces where the stories that don't or have not yet arrived at where we want that, you know, American dreamy sort of success ending, right? Like the stories that haven't gotten there yet. Like where do we find the spaces to facilitate those and make sure that the expectation isn't that, oh, I want to hear your story because you've triumphed, right? Like what about the people that haven't triumphed yet, and what do we do to hear those stories more proactively, I guess. I don't know if that makes sense, but
No, I get what you're saying. I think it's a really good question, because I think, inherent in the idea of story is it's got a beginning, middle, and end, right? We're gonna go to, and then what happened. But what I hear you asking, Emma, and correct me if I'm wrong, is that how do we create a space for the people who are still in the middle of the story to be able to live that experience in a way that they don't feel like they have to be hidden, that they can admit to being in the middle of the story? Is that what I'm hearing you say?
yeah, I think that summarizes it better than I did, maybe.
It's a good. What do you guys have any thoughts about this?
Do. So I deal with that every day with the moms in our nonprofit. We focus on, we don't, because none of a story is ended. I think that's the first conversation that needs to be had. We're all in pursuit of something until the day that we're done. So I always tell them that we're always going to be working on something till God either takes us or we either leave, whatever choice we make. So we celebrate the moments that we've already made, and we tell the story at the part that it is, because there's always a part of the story that has ended. So we need to focus on that piece, that the story hasn't fully ended, but we need to focus on what you've already achieved, or which would you like to see being achieved, or talking to them about where are they, and getting them to be grateful for what they've made it, even if it's a traumatic experience. Like, oh wow, you've really made it from that, and congratulations, because the fact that you're talking to me and there's still breath in your body, that there's hope and opportunity for something greater. So we focus on teaching them those little moments. And even as a society, like, we have come from a place that, even like, for instance, with the current death, even though there is constantly people dying, Denzel Washington stopped one person from dying the other day. So if we could at least celebrate that moment that a man decided to get out of his car and there could have been a different scenario, we can now say, hey, we've made it. The fact that we have African Americans and Blacks and whites and any kind of race on this conversation, we have made it. And if we celebrate that moment, the story isn't done, because we're still communicating to make things greater. I think that would be a good piece to help people overall, is look at what they have experienced, what they've overcame, and what they're in pursuit of, and giving them the tools that they need to be successful for the pursuit of those processes.
Yeah, I love that.
If
Amelia, Uchenna?
If I could add on to that, I think it's something that I have struggled with and am working on every day in medical practice, and then in also working with community organizations and even, resident civic clubs and stuff, is approaching every conversation, every meeting, assuming that I do not have any of the answers and I am just there to learn. I think if I enter an interaction with an idea of how it'll go, with a kind of, outline of the story that'll happen or that I'm about to hear, then I run the risk of, one, not picking up on anything that the other person or group is saying, and then two, not being able to help in any way because I haven't heard what they need to say. And so I think that approach, the very open listening, and it takes a concerted effort, and also recognizing when it's just not the right time and you gotta kind of step away from that situation, or at least recognize it, is important in letting people, in creating the space for all types of stories, not just the tragedies, not just the triumphs, not just any kind of prescriptive outline that you have, because people know themselves, they know their communities better than I ever will, And so trying to come at it with a blank slate, knowing all the baggage I carry into everything I do, and trying to leave that at the door, I think is helpful.
Great. Okay, cool. Uchenna, you got something?
Yeah. So for me, I think there are two words that popped out when you asked the question, when she was talking. Number one, it's vulnerability and connectedness. So I think when people hear stories of triumph, right, they often retreat, right? Because they think, oh my gosh, I haven't succeeded, I haven't done that, I haven't done that, right? But I think it's how, in my connection, how to connect and be vulnerable with others. And that allows them to speak no matter where they're at in their journey. Because if you truly listen, you can connect with them, because as they're telling their story, you can identify along the way where you were right where they were at some point mentally. It may not have been the exact same experience, but the fear and the anxiety of all of that comes with where you're at in your journey. And I think that's a part of being vulnerable and being able to say, I understand because I've been there. I mean, I don't know, I'm a new doctor, if you will, but I'm an old head, right? And so I bring my experiences and all of my exposure into every one of my patient contacts. And I've done a really good job of being able to connect, but I'm able to connect because I think I'm vulnerable. I'm even vulnerable in my room when it's a one-on-one situation, because when someone is the most vulnerable, you have to be vulnerable too, or they're never going to be able to start opening up, because I think the opening up for them helps them, and they're able to start talking when they realize that the people that they're talking to are human just like them. They've experienced somehow, some shape or form, the same thing that they've experienced. So I think you being vulnerable and allowing that other person to be vulnerable, and you share together, and then being connected, people know what's real. Period. And no one's going to share, no one's going to share anything, good, bad, or ugly, if you're not real. So, or they feel that the person they're speaking to, or they feel that the audience they're reaching out to isn't real. So I think as a whole, coming from my vantage point, I have to be vulnerable with anyone I work with or encounter, because everyone has a story. I say that to my sons. When you're writing your essay for college, you have to have a story. We all have stories. They may not be as glamorous as others, but you have a story because it's your experience on how your life is happening. But you have to be a person that has good insight, if you will, and very introspective. But we all have stories, and I think everybody wants to hear a story, whether it's the end or the middle. Because when it's the middle and I share this, you can be, if they share it with you, you can be a part of helping them navigate to a better ending. So vulnerability and connectedness for me would be how you're able to have people share, even if they feel like they haven't overcome, or they're actually in the thick of whatever it is. They're in the thick of it. Because if you can get them to open up, you can actually help them overcome those obstacles. So.
All three of your answers are resonating so much inside of me, because it's how I feel as well. I mean, in my personal story, some of my friends know that I didn't start my master's until I was 50. And it was after I turned 50 and my brain had healed from the chemo and all this. My husband came to me and said, okay, you've been talking about a graduate degree all your life. You either sign up by January the 15th or you never talk about it again. And the story that I had inside of me is that, oh, I'm too old. But also too, that I hadn't done everything perfectly yet. I hadn't done it right. I had to have all my ducks in a row before I could even open my mouth. And I feel super challenged about telling stories to people I really don't know, because I really have this inherent feeling that it can't measure up. That whether it's my personal story or the way I tell the story, the way I've structured my story, the way I've written it or thought about it, it still is not, it doesn't measure up to the polished thing that I hear presented by other folks. And the vulnerability for me is really key. What I've learned is how important it is to be present within the conversation. and to feel myself in that space. And as opposed to what Amelia was saying and you were saying, all y'all were saying as far as jumping ahead to the end or trying to make the story that's in my head manifest. A recent saying that I've adopted in my life is that the other thing is too, is that everybody's been dealt a deck of cards, and within that deck are a few face cards that are jackasses, right? And every once in a while we play one of our jackass cards. And there are people in my life who have forgiven me for that play. And that gives me the room to also forgive them when they play those cards. And just being present at that moment and going, okay, yeah, I see what happened. I've done that before. Let's just keep moving, you know? And that helps a lot too. But being in the middle of the story, I think acknowledging the fact that we are all in the middle of our stories is really vitally important. Great question, Emma. What else we got out there? Who else has some questions? I want to hear from y'all. Oh, I did see a question on the chat from Carlos. And he was asking us about what are our most influential sources in terms of authors or media. And he said the Seeing White series from the podcast Seen on Radio from Duke University was one of his influences. I have to second you, Carlos. That was an absolutely fantastic series. What about you three? What other resources have you guys been tapping into that's helped?
I'll go first because very little. And I only say that because for the past like 15 years of my life, the only resources I've had are medical. So unfortunately, I haven't really had an opportunity to tap in. I get a lot of good podcast resources. I know June is on the phone or on the webinar, and she's given me a host of things to tap into. But it's really interesting. I watch the news a lot, and I read the news a lot. But what I found, and this is just me, is that I really have to use like my inner inspiration a lot, because life is so fast and it's just really fast. And I take a lot of information, I try to piece it together and see what makes sense and what applies to me and how it applies to me. But it's just so many different, to me, it's just so much. I think it's information overload. Like I'm trying to listen to my husband, listen to this podcast, listen to this, listen to that. I'm like, oh my gosh, I don't have time. But I say, this may be kind of contra, but find whatever speaks to you. For me, and I can't say anything, one specific thing, to be honest, because I take bits and pieces from everything. I steal bits and pieces from everything. Whatever speaks to you and it speaks to you immediately, that's what you go with. For me, it's stories from other people. It really is. And that's what inspires me and helps me continue down my path. So.
Crystal, Amelia, what about you guys?
I'm a reader. I'm also a writer, so I love to read. I'm old fashioned, so I still like hard books. I like Napoleon Hill. I love Bob Proctor. He's really good. I like Les Brown, T.D. Jakes. I'm a real big reader on personal development, because I find that if I take care of me, I can pour properly. So I focus on trying to constantly replenish myself, because I'm always pouring, whether it's at home with the kids or the nonprofit or in my business. I service several clients a day. So I always focus on replenishing. But lately during quarantine, I minimized my nonprofit, took a lot of stuff virtual, and I fired a lot of my for-profit clients so I could rejuvenate myself. And I focused on, like Uchenna said, I think I was in an information overload space. So what I did was I rejuvenated myself and I became a content creator. And I did a lot of writing. I actually wrote 4 books during the quarantine. I had a lot of stuff in me that I didn't realize was there. So I just finished a update on one of my books that I had previously put on Amazon and published, and it's a devotional, so I just redid it. And so I'm working on this other book that I've just wrapped up. So hopefully I can get it to edit and send out. And I didn't realize how much was in me until I started trying to read again. And I wasn't comprehending anything that was happening. I was like, what is, like, is something wrong with me? And then I realized I was in an info overload. So I just revamped my entire brand and started writing and ended up with books.
Wow.
Mm.
Amelia. Oh, no, go ahead.
Oh, this is Ellen Friedman, and I say
Hi, Ellen.
Hi. I want to say that I'm sure I'm speaking for almost all of the listeners, but you are all truly inspirational. And I mean, I'm sure that I hope that you feel it, because I definitely feel that when listening to you. I tuned into the webcast not knowing, I actually thought it was going to be data driven about health disparities, but I'm actually delighted with the content, although it was somewhat of a surprise. You know, it's such a dark and difficult time right now. It's on so many different levels, and racism is like a whole other layer that we can't ignore. I mean, it's like really in our faces, and I have empathy for myself, because in a way, I mean, like, it's hard. I mean, I'm in such a blessed and fortunate position, and I live with gratitude every day. But these issues are so huge that it's so hard to know how to do anything that's meaningful. And I know that you say, well, call it out when you hear it. And, you know, I mean, I'm old enough. It's hard to do when you're very young to do that. I'm old enough that if I hear a remark that I think is racist, I'm not afraid to say anything. And hopefully those small acts eventually have some kind of impact. But these issues are so huge and so painful. And I guess I feel like I want to, I mean, not that I'm a spokesperson for the white population of the world, because I'm not, but I personally feel terrible. I mean, I'm going to cry as I'm talking, but I honestly, I can't take what's happening right now. And it's bigger than all of us. And I don't know, I mean, and I'm registering voters, and I'm doing, you know, I'm trying to do some, you know, I became a registrar, the voters registrar. I'm trying to do stuff, but it's like too big, and it's I don't know, and I don't want to feel discouraged.
Can I say something, if you don't mind?
Go for
Is
it.
that okay, Cecilia?
I hope you say something that gives me some hope.
So
I need some hope.
well, it's interesting that you said this, because my little sister, on my way, I work nights, so I was on my way home this morning at 8, and my sister called me, and she saw the news of me talking, and she said, you know, Chin, I feel like I've lost hope, because it's too much, it's overwhelming, I don't know what to do. And this is what I told her. I said, you know, she said, I mean, you do this and you do that, because that's what I do, it's just me. And I told her, honestly, you do what you can. Don't compare yourself to anyone else. If you can't go to a protest and you can write a letter to a congressman, you do that. Because I imagine, it's what I said to her, if 1 million people are out there saying it's overwhelming, I can't do anything. Those 1 million people can turn around and do one little act that they can do. That collective would be so powerful, right? That would be a punch that would knock this world off its axis. And I think the lie and the trick of this evil is to make you feel hopeless, so you do not act. Yeah. So you be registering voters, that's huge. That's, you are doing a great service, because disenfranchisement is real, right? Disenfranchisement is the underbelly of so much as to why we have what we have in the White House right now. Mm-hmm. And I won't get on that. But I say this to say, don't feel hopeless, because you're doing. When you're not doing, and Amelia, you said this, and I use this all the time, if you are complacent, you are complicit. So one act is all I ask from anybody, and myself. I mean, honestly, I went to the protest. I had no intention of going to the protest, but something told me, look up when there's going to be a protest here. It happened to be at 2:00, and I got home at 10 a.m. yesterday. And I said to my son, we're going to the protest today. Wake me up at noon. Wake me up at noon. And I could have slept through that. And I am the flooding of people that have called me from seeing what my children did, because we had them speak because they're teenage Black boys. The impact, I could have slept through that. So that one act touched how many other people? So I say, just do what you can, and don't worry about not being able to do enough, because together as a collective whole, if we each do one thing, really, if you think about it, because I firmly believe that there is more love in this world than hate. And if those that have love in their heart do one thing, that becomes a sounding block. So don't feel hopeless. I want to cry with you. I cried yesterday because I felt like I hadn't done enough in the past. I always speak on things. So don't feel hopeless, because I always say this, and this is my little saying, it's not where you start, it's where you finish along that. It's where you finish your journey, but that path to get there is what those defining moments that will actually define you. So the past is the past. We can't do anything about it. There's no reason to even dwell on what happened in the past, because it just brings you down. Just keep moving forward and know that every individual thing that you do, one step at a time, it makes a difference, because if you touch one life, that one life touches another life, so it becomes exponential and you don't even ever see it. But I promise you it's there.
Yeah.
I think you just made me think, you had touched on too, that the idea of microaggressions and how over time it can affect one's health, and then also systems in general. So what you're getting at, it sounds very much like the very opposite of that, like micro positive actions or whatever, and that over time you can kind of flip the system. And I would also like to add that, it's not, in advocacy work, at least, we oftentimes dream of, we're going to write a health policy, or we're going to, put a stop sign on this street where there needs to be one. But sometimes it's just even like examining yourself inside, and challenging preconceived notions, challenging your previous actions, and then figuring out how to be better moving forward. And then engaging, like we said, in those. It starts with the individual, and we think about our circles, right? Individual to family, to neighborhood, to community, to state, to nation.
Mm-hmm.
And we can affect change in all of those realms. And oftentimes just even starting with ourselves, then that ripple effect happens. So yeah, go forth and fight the good fight.
Well, I want to take you back to the whole metaphor, the biological model of the mycorrhizae, right? Is that we can drip in, healing as well as the venom. You can drip in resources. You can drip in every time we add to that through the network, every time we add love to the network, acceptance, every time we pause long enough and see a person for who they are as an individual, complex individual, then that has the potential to spread. And I agree with you, Ellen. There have been times I've beat up on myself because I haven't done enough. I haven't said enough. I haven't been there enough. There's so many not enoughs. But we're here today, and we're challenging the stories that we're telling each other, right?
Can I pull out my coaching hat for a minute?
Go for it, girl.
I just want to tell Ellen, I think if nothing else, thank you for your heart. Because even in the work, sometimes we get so caught up in what we're going to do to make a change that not everyone's heart is in the right place. And I believe that a great heart is the foundation for transition of change to even be invoked. So number one, thank you for even having the heart to make a difference, and then challenging yourself in a separate space to do something that is the best thing that could ever be done, by bringing full change to the system, by bringing new voters and educating them on the process of what needs to happen and why it should happen. Thank you for that, because there are a lot of people that are in the younger generations that don't even understand what voting means. And you really understand what the fight for voting is. So thank you for what you've done, yes, but thank you for the heart to even consider doing that, because in this time, it's hard to even have the right heart because hate is so strong that you could just say, F it, I give up, I'm done, I'm not playing with these people. But thank you for fighting beyond past how you feel to just do the work and keep pushing toward it. And for that, Queen, you are amazing. I thank you for that. If nothing else, thank you for just wanting to do it, because that within itself is just fabulous. And I think I wanted to just say, from me to you, thank you for being a leader to women, to individuals, and to the people within generations that's going to come beyond you. Because think about the education that you're bringing to the voting. It's not just for the people you're helping. You have taught them and brought something to them that they can leave behind for legacy. So even after you're gone, your name will still be great, because I always believe to whom much is given, much is required. So keep pushing past that point, because you've done great. So thank you.
Feel the love. This is awesome. There's a lot of really great stuff that's happening on chat right now. I want to thank Anna. You put up a big list of anti-racism resources for white folk. That's going to be a really great link for folks to follow up on and take a look at things. I'm going to reiterate what Carlos said as far as the Seeing White podcast. It's part of the Scene on Radio, SCENE on Radio podcast series. And they spent an entire year examining what the word white meant. And it's one of the reasons why I put black and white on as far as the single stories, because every single one of those single stories are just stories. They're not real. There's no reality to them. They're created in our head. So that podcast does a really good job of diving into the history of how that was created. Also, Anna, you're putting up some more resources up here on racialized trauma. Great. There's a wonderful article that I found called Black Bodies, White Bodies by Sander L. Gilman, Gilman. And Jessica, I think one of the things I'd like to do for everybody who registered, when we send out the link to this, can we also send a list of resources that the panels and other people are contributing that we can send out to everybody who participated? I would really love to do that. Thank you. Great.
This is June.
Hi, June.
Hi, Celia.
I see you in San Francisco.
Yeah, I just, whatever, that's the only one I could get so far. I just think this is awesome. I would like to talk to you more about what you all are doing, because the March of Dimes is actually also really wanting to work on health equity. And I just think the way you guys have presented this was awesome, because it took a different way of presenting information. And I just, so thank you very much for doing it. And thank you, Ruth, for telling me about it. But another podcast that was I just started listening to is 1619. I think it was a series in on the New York Times, and then The Practice. I put it on there as well, because it was more about the history and relation to medical providers. And I think, and then there's another book I'm listening to. I don't know if other people are aware of it. It's called Medical Apartheid. And I'm thinking, wow, when I listen to when I'm listening to it, I'm thinking, okay, this is history that influences, people's ideas and choices, and it's very enlightening as well. So thank you. I'm going to call you up.
Fabulous. I love that.
Okay.
And that actually reminds me, June, one of the pieces of research that I came across when I was doing my paper, doing my research is that really the history of the development of the practice of American gynecology and obstetrics.
Oh yes,
and
I
that,
learned it.
Yeah, it's a sad story. It is one about, it was
Dr. Sims.
Yes. Well, very, very brief. The fact is that a lot of what we know as far as gynecology and obstetrics, the way it was practiced early in America, was built on the bodies of women who were regarded as less than human, African Americans and Irish, right? Those were the two groups that a lot of the practices were developed on, that were then taken to women who had husbands who would pay for it, right? But all the experimentation happened on women's bodies that were considered disposable.
Mm-hmm.
And there's an essential epistemology that comes with that history. And one of the things that I'm trying to get people to understand as far as the talking about stories and the fact that, You know, with the forest, it's sending those trauma signals back and forth through that unconscious connection. We do that through our communities back and forth in our present time, but we also do it in depth. Previous generations are still transmitting attitudes, our positions, experiences, you know, our perspectives, everything. And unconsciously, we are still fighting those on a daily level, right? In our interactions with ourselves as well as with other people. And it's really important for us to grasp and understand. I'm so glad you joined us today, June. It's so good to see you.
Yeah, me too.
Good. What else have we got out there? What else do we have to
I would just like to thank you, Cecilia, for providing this space and the content, inviting the content to approach these problems in a different way. I think this could very easily have gone kind of that data-driven, you know, reiteration of all the disparities, more like celebrating the problem than anything. And I think you created a forum that gets to the heart of it, and then also has produced some pretty productive what can we do next steps. So thank you. For everyone participating too. Thank you very much.
I really appreciate that. Thank you very much. This has been a really neat experience, and I've really enjoyed it. We still have a bunch of people signed on with us. Let's see. Anybody want to add anything? I'm really being mindful of the fact we've been online for 2 hours already. Although this has been such a great conversation, I feel we could stay another 2 hours. Anybody have anything they'd like to add before we close up?
May I want to ask a question.
Sure, go for it.
I'll pose this to everyone. I know I mentioned when I introduced myself, my thoughts around women of color when it comes to healthcare and their treatment. But not just women of color, people of color being seen by other people of color. I wanted the opinions, yours too, I mean, everybody's opinion. I'm addressing to all of our healthcare professionals and individual professionals. What do y'all think about that? And whatever you say will not offend me. So I'm just curious, like where your thoughts are with that.
And this is the statement you made as far as Black professionals treating Black.
My statement was, in order to, I guess to sum it up, would be in order to really eliminate healthcare disparities, and I'm speaking just for Black healthcare disparities, let's say that for now, that I feel that Blacks should go to Black doctors. I mean, that's basically what I'm saying. But that's what I'm coming, I don't know. So anyway, I'm leaving it at that, and I'm leaving that, I'm leaving it open.
That's a great question. Ellen, did I see you raising your hand? Go for it.
Yes. You know, I think that there's a lot of merit to that. And I think as a woman physician, I have had many families say, you know, I really wanted my daughter to go to a woman doctor. And when I moved here away from Boston, I had a couple of pediatricians said that they sent their daughter to me specifically because they wanted their daughter to know what the lifetime possibilities were. And so I really understand that meeting a like person helps you visualize yourself in that role. And so I'm not offended by that idea. I think it's a great idea, but I just think it's going to take a really long time to get there when there are enough Black physicians. And so I think we should be doing that, but I still think at the same time, and I know you agree with this, but I think we have to work on white racism and subconscious bias, implicit bias for whites, while aiming to have additional Black practitioners.
And I want to say this, I like women going to women, like I think a lot of us think that way. It's very interesting what you said, because there are Blacks that, but through generations of self-hate, if you will, they believe the narrative too, that white is better. So there are many that feel that they need a white doctor. I mean, right, wrong, or otherwise.
Right,
so there's so much more embedded, right? That, I mean, can we get there, not even just from a quantitative perspective, but like understanding mentally what that might mean for your healthcare, and then speak to, do you feel as a white physician or an Asian physician, or do you feel like you do a disservice, or I mean, just all of that, you know, not just quantitative like the numbers, but how do you feel about that, especially for those that have dedicated their lives to minorities, right? And you've worked hard to understand that culturally, so you can better serve your patient population, or not even if you're a doctor, a nurse practitioner, whatever whatever you
Also, we have many physicians and providers who come from other countries, and they've grown up with their whole culture there, and then they come here to work. So you've got another layer.
One of the things that I encountered when I was doing my research, and it's something that, I mean, I've been paying attention. This is not my first career, right? This is not my first rodeo. There's been other things that I've done in my life. I've worked in museum fields. I've worked as an accountant. I'm sorry, not an accountant, hell no, but as a consultant for a multimedia agency. And one of the big things that I've been paying attention to is identity and how we construct it and how hard we hold on to it. When I was doing my research, it was one of the things I was paying attention to as far as how that identity ended up affecting the way that that person seemed to be reflecting about themselves and about the groups around them. And it made me pay attention to my other conversations outside of my research and how entrenched people get into their identity, and they use that as kind of a way to separate them from other people. So in like, for instance, in the Health Equity Day that we had in November, it was a really amazing experience, but primarily the people who joined us for that day were African-American community members, particularly those who were medical professionals. And some of them voiced perceptions of the African-American community that were the ones that were identified as underserved, ones that had all the poverty and the issues with single parent households and all of that. And they were talking about that community in a way that I've heard some of my less developed white friends talk about that community. That they said some of the stereotypes, or used some of the single stories that I was used to hearing in some other populations. So I don't think that single story problem is siloed by ethnicity. I think it's also across economic status and social position.
I think in addition to having more diversity in medical providers, because I don't think, and again, this is me wishing against the impossible, that I am, free of these stories, that the single story doesn't affect me. I'm in control of the stories that define my life and that of my patient. Not the case, right?
Right.
But how do we change that, right? And so it doesn't have to necessarily, they don't have to be exclusive changes to themselves, but I think diversifying the provider population, but then also changing how we train physicians and getting a more diverse healthcare system leadership, as far as research, as far as healthcare design and implementation, would also help kind of, in addition to all of that. But I think, just like you were getting at, even if, everybody saw a physician that looked just like them, that does not mean that that physician brings everything that that patient is bringing into that encounter. And in addition, then we also work with that power dynamic as physicians. We hold it with our patients, and how do we dissolve that too, to make them, as you said, Uchenna, right? They see us as vulnerable as well. Whether it's a shared experience of not necessarily in a life event, but maybe it's, I've felt that fear before. It was not in the same circumstances that you felt that fear, but I know that fear. I know that anxiety. And now I'm digressing, but I think definitely we need to change the system.
Well, you said something I think it was important as far as how we're recruiting and how we're training physicians. I think that is also, it is such a select group who ends up being trained as physicians. There's good reason for that. You want people who are going to be mature, going to be well trained, that they're going to be able to take the information and apply it correctly. But it kind of creates a bubble, I think, around doctors. And that there were people that I talked to who came from medical families, that it was a trade within the family. And so you end up with attitudes within the family that travel down the generations as well as through the culture. So how is it that we bring people into medical school who have a depth of human experiences that they can bring into the medical exam room, right? So do we start bringing in folks and we create different categories of medical providers that allow for people of my vintage to come in and actually be somebody meaningful in a medical setting, in a clinical setting, so that I can bring my experience in a practical way? How do we do this?
You know,
Whoops. Sorry.
And I mean, it also starts outside of the medical school walls or the clinic exam walls. It's how we interact with other people in our communities. It's how we interact with our family members. It's how we learn from others, even before we get to the medical school. So, yeah.
I struggle. So me posing that question right to myself, it's really interesting because I think it would be, on one hand, I see the pros, lots of pros, but I mean, I see cons too, because I think it isolates, but it also actually, what's the word? It takes away an experience from other people, right? Life is full of experience and exposure. So if you've now not been exposed, doesn't that mean that you are less able to relate, right? And it's kind of selfish, right? Because now you're not sharing, right? I mean, culturally. So there's a lot to it, and I think you're right. I mean, I don't have an answer, but I know that it requires not just healthcare, because let me say this: if you go straight through medical school or any training from college into your training, you haven't experienced. And maybe that's the bridge, right? Maybe like a lot of like getting your MBA, they require you to work for a lot of the big programs require you to have experience first, because that allows you to see the world not just from your narrow perspective, and you have some meaningful experiences to bring, and maybe you've encountered some things where you can relate and you can connect, right, and force you to be vulnerable. So I don't have an answer, but I say, how do we change the system? That's the $1 million question. And that's one reason why I got into health care, because I want to be on the administrative side, policy side, so I can help the change. But it's understanding that change is needed. And the problem I think we have right now, or the problem we've had probably for centuries, is that there are the few that are in charge are the arrogant and those that have privilege, and they can't see the other vantage points. And so they can't, for the life of them, understand what's wrong and why people are complaining and why change has to happen. And that's where the voices come into play, right? We start chipping away, chipping away at things. But honestly, that's the only way things are going to change, because the foundation is so the layers are so thick, it's almost to the core. And I don't know.
I want to draw attention to what Amelia said earlier when she was sharing her story in your written portion that you did, Amelia, where you started talking about all the different, the switch in perspective as far as how the clinical encounter is staged, how it occurs, who gets to define what kind of questions are you asking, the perspective that you have with the patient, all of those things, I think I was so inspired by that. And that's something that I would love to just kind of, hammer in the stone of some medical school wall. This is how do you need to, look at this problem, or ask people. There was a person who helped me out a lot with thinking about my project. And one of the things that she cited to me was some research that talked about that even when you educate doctors through implicit bias training, when you put them through a training that is learning the terms, learning all the different knowledge gets poured into their head, that sometimes what comes out are people who are even more entrenched in their implicit bias because you've given them more to build the walls with. That it wasn't the empirical information that was going to make a change. It was actually the experiential component, like what it is we're doing here as far as the storytelling, that actually creates the awareness and the depth and the challenge that's necessary in order to break some of those walls. Well, folks, it is 4:11 p.m. We've been at this for 2 hours, and if I had a bunch of wine I could share with everybody and just continue the conversation over a bar, I would do it, but I know everybody has other things that you'd like to do. I am incredibly grateful for everybody who came and joined us today. Thank you so much. Crystal had to leave before we were able to wrap things up, so hopefully she'll listen to the recording and hear me saying how amazing she is and how grateful I am that she joined us. Amelia, Uchenna, you all are just amazing to me, and I'm so humbled that you agreed to engage in this conversation. All four of us, I think this was really an amazing experience. For those of you else out there, we're going to be sharing the recording of this discussion. We're also going to be sharing a list of resources. Jessica is making notes now in the chat. If you've got some other resources you'd like to have added to that list, please throw them in there. And she has information on how to reach out to us if you want to have a one-on-one. So thank you very much. Go forth, go change the story. Thank you.
Cecilia,
very much.
I want to before we go, I want to say
Yeah.
thank you for this. The idea, the notion, everything is amazing, and I think this could be very groundbreaking and it's a game changer.
Mm-hmm.
So I truly appreciate you, and I'm so happy we were connected. And Crystal's gone, but Amelia, you're amazing, and I plan on us working together.
Awesome. Good. You read my mind. So
But to everyone on the call, I also want to say thank you for allowing us to share a little bit of us with you, and the same, because I'm all about sharing, because that's how we connect to people. So much love, much love.
yeah.
Much love. All right, folks, I'm going to hit the stop button.
Okay.
Hey, you guys. Thank you very much.
Bye-bye.
See, I'll talk to you soon.
Okay,
Talk to you
sounds
soon.
good.
Bye-bye.
Bye,
Bye-bye.
folks. Stay safe.
Bye-bye.